journey to the underbelly of a city, where we'll be meeting Cryptosporidium, a parasite that causes diarrhea in immunocompromised patients. We're calling this a tale from the crypt. Our backdrop is an underground, flooded crypt with vaulted ceilings and columns. In AIDS patients, Cryptosporidium causes severe, unrelenting diarrhea. In fact, it's the organism most commonly identified in HIV-positive patients with diarrhea. So we'll add our protagonist here, who has an immunocompromised cane, to remind you of the HIV-positive population. In the otherwise immunocompetent, it causes mild, watery diarrhea, so they escape relatively unscathed. When you hear AIDS and diarrhea, think Cryptosporidium. Don't confuse this with Cryptococcus, a fungus that causes meningitis, especially in the immunocompromised. So as you can see, our crypt is partially flooded with stagnant poop water, since crypto causes watery diarrhea. Now, Cryptosporidia are unicellular, partially acid-fast organisms. They complete their entire life cycle within a single animal, and in the process create oocysts that are released in the feces, which can then be transmitted fecal-orally. Those at risk would be people who swim in dirty water, campers, and people who work with animals. So our character is wearing a tired-looking cowboy hat and pink poncho. We haven't seen this symbol for a while, but this is our symbol for acid fast. Cryptosporidium are the only parasites we'll learn about that stay in acid fast. So our homeless cowboy's eyes are cast downwards towards the water, as if he's looking for something. Well, the first thing we see are bubbles. Bubbles are a recurring symbol for infectious cysts that get passed through watery stool. Giardia has similar bubbles in its sketch. But there ain't no money in bubbles. He must be looking for something else. He's looking for these gems that are scattered throughout the water. More specifically, they're amethyst gems, which kind of sounds similar to acid fast, and they also look like acid fast. This is what Cryptosporidium looks like with acid fast staining, and you gotta admit, it kind of looks like little amethyst crystals floating around in water, right? Well, there's another aspect to these gems that I want you to pay attention to. Notice that they're all multifaceted. This is to represent how each oocyst is actually composed of 4 motile sporozoites, just waiting to be released once ingested. These sporozoites then attach to the intestinal wall and cause diarrhea. We'll draw this pipe in the back here that will remind you of the damage to the intestinal wall. It's narrow and without haustra, like the colons in many of our sketches, and that's because Cryptosporidium is usually associated with the small intestine. However, it can cause colitis as well. So let's say you have a patient with diarrhea, and you see some oocysts with acid-fast staining on stool O and P, or maybe you see a picture of it on your test, and you're asked how to treat it. Well, one drug is nitazoxanide, an antiprotozoal that can be used exclusively in immunocompetent hosts. We'll illustrate nitazoxanide with a knitted sock that our protagonist will be holding in order to collect gems. Knitted socks sounds like nitazoxanide. So our protagonist is using the sock to filter through the water in search of gems. And you can see the water dripping down from the sock. In a similar way, oocysts can be filtered out of the water supply, thus protecting people from infection. In fact, Cryptosporidium is highly resistant to chlorination, so filtration is an excellent option. Another drug that can be used is spiramycin, which is a macrolide antibiotic. Do you remember what our recurring symbol for macrolides were? Right, crows, for macrolide. Since spiramycin is a pretty unique drug, let's make these crows unique. We'll make them spirit crows. It's an underground crypt, so live crows wouldn't make sense. Spirit for spiramycin. You should know, however, that this drug is not FDA approved in the US. And other than these 2 medications, treatment is mainly supportive. As with any severe diarrhea, pay special attention to fluid status and electrolyte balance. And that's about all you need to know. Quick and painless. Thanks for listening.